Hello, I'm A.R. Bernard, and welcome to today's program. Thanks once again for tuning in. Joining us today is facial plastic and restoration surgeon, Dr. Monte Harris. Dr. Harris is a recognized authority in comprehensive cosmetic facial rejuvenation, and he is sought by patients around the world for his culturally sensitive approach to rhinoplasty and hair restoration. He is double board certified by the American Board of Facial Plastic and Reconstructive Surgery and the American Board of, get this, otolaryngology, which is simply, according to him, head and neck surgery. Dr. Harris has dedicated his professional career to pushing the envelope to expand our cultural appreciation for the diversity of beauty. Dr. Harris, good to have you with us on the program.
Thank you.
Thank you. And let's begin with this. What drew you, what attracted you to cosmetic surgery?
You know, I was always the artsy kid growing up. You know, how things look has always meant a lot to me. And I think that as we look to sort of do the best that we could do and sort of share our spiritual gifts, you know, I think that that idea of aesthetics has been profoundly important to me. So this was just a way that I could sort of do those things that I think that I can do well and do it in a manner that I ideally would be contribute to humanity. So I like the way things look.
And so you appreciate beauty. You said spiritual gift.
Right.
You're making a connection there.
You know, one of the challenges, and this has been a little bit of my journey, is understanding that we're here for a reason. And, you know, this idea of things looking good or my ability to see when something looks good, I thought I've always had a gift for that. So this idea of how do I package this gift with this idea of what God would want me to do. So there's been this struggle for me to understand that there's a pathway, you know, with this idea of looking good, you know, and that looking good gives you energy, you know, to feel good. And then the question is, well, what are you going to do with all that feel-good energy? And I think that the pathway should be to do good. And I think that when we look at the aesthetic industry as a whole, there's always been this sort of stop where it's look good, feel good, and then it stops there. But that's not where it should stop. I mean, that we should really look at that idea of feeling good about ourselves and looking good, it transferring to doing good or doing God's work. So that's been, you know, my sort of journey. Like, how do I package this? How do I understand that, you know, this ability to feel good about beauty is energy? You know, it's simply sometimes, you know, folks get a haircut. You know, just by getting that haircut, you know, you can feel like, oh, this makes me feel good. But then it can't stop there. You know, it can't stop at just feeling good. So, you know, I have been excited to be able to sort of understand that I do feel that I have a gift, and then how does that gift transfer?
It's interesting how you tie it to your faith. Obviously, we're hearing that you're a man of faith coming through, and for you, it's holistic. It's a complete system. And it's true. I mean, psychologically, for some reason, you think your car runs better after you get it washed. That's the effect on our minds. And we tend to feel better about ourselves and function differently when we think that we look good or feel that we look good. But you started practicing this, it's only been about, what, 10 years or so?
You know, I've probably about 20. You know,
about 20 years?
Yeah, I actually started my sort of general surgery, you know, residency back in 93. So we about 17 years or so. And it's been this idea of how do you continue to grow, how do you continue to sort of cultivate those unique things about you to do something worthwhile. And so it's been exciting, you know, because I really truly feel that I'm walking, you know, the path that I should.
And it is about giving back. I read a quote this morning where it says, life is God's gift to us, and what we do with life is our gift back to God. Now, but you were teaching. You were a professor. You revealed that you're a professor.
Yeah. You know, it's funny that I'm from Gary, Indiana, and my mother's a school teacher. And, you know, my dad taught history for a bit before embarking in a career in printing, and my wife's a teacher. So this, you know, this idea of teaching has always been extremely important to me, and I've always thrived in academic settings. So you know, this idea of merging beauty and aesthetics, you know, with teaching has been a core component, I guess, of my approach. So I was a professor at University of Michigan, and even now, I teach the residents, and they have an academic appointments at both Georgetown and Howard Universities in D.C. So I think that, when we look at redefining, plastic surgery or redefining beauty, there's a whole educational component to that. And I think that, folks want to know. People, thirst knowledge, and they look for different venues and avenues to get that. And I think in the aesthetic realm, I think teaching is what's most important. And then from that, there's understanding. From that, there is realistic expectations. From that, there is an exploration of how technology and culture comes into play. So I think that first and foremost, we're teachers.
What is a profile of the individuals that come for this type of surgery?
It's everyone. And I think that when we've had...
Not just the rich and famous, to celebrities.
Because, we, to a certain degree, we have to sort of change our understanding of what plastic surgery is, and change our understanding of what this pursuit of beauty is. So everyone, to a certain degree, wants to look a little bit better, or wants to look the best that they can. So I may have, a college student, that's coming in because she has uneven complexion. I may have a gentleman that's in his 50s whose hair is thinning. I may have a young woman that's in, let's say, her 40s that say, hey, I'm noticing a little bit of my eyes look tired. So it's amazing, the expanse. I had an event at the office just this past weekend, and a woman came to me and said, hey, Dr. Harris, I want to bring my mom to you. She's 92 years old, and she's got some thinning, in her hair, but it matters. It's never one
now,
of
is that a surgery that you would perform,
right, well,
a 92-year-old woman?
It wouldn't be a surgery. It's more of there's something that we can do to support stimulating hair growth, and just having sort of healthy hair care practices. So when we talk about this idea of what plastic surgery is today, it's a lot of sort of education. It's a lot of sort of having healthy lifestyle practices that sort of give you that inner beauty that expresses outwardly. So, everyone's a candidate.
We have to go to a break. When we come back, I'd like to ask about the pre-surgery process that you take people through. Because it sounds like you walk them through a bit of a journey with you. We'll be right back. Don't go away. And welcome back. Before we went to the break, you're going to tell us about the process that you take people through pre-surgery.
Right. And, one of the challenges when folks come to my office, and, I'm a facial guy, so it's always about that's above the shoulders. And, a part of it is understanding, what their idea is of change, what their expectation is. And then there's a certain conversation that we have with regards to me understanding their identity, who they consider themselves to be, their aesthetic identity. So it may be, let's say, a rhinoplasty or a nose reshaping consultation. A part of it is me understanding, what their goals are, and then, to the same degree, me having an appreciation for what type of change could be appropriate. So it ends up being a true a dialogue initially, with just trying to sort of co-create a vision for what they consider to be the appropriate change. So I like to say that it's establishing a partnership at the onset, and then we have a very, I would say, a more of a unique approach to facial plastic surgery, and that's bringing in culture. So there's a whole conversation that...
Well, that's interesting, because it sounds like it's not just, here are a few noses, you can select number 1 through 5, but it's more than that.
Yeah, and I think that's where, to a certain degree, where a lot of the aesthetic industry, and particularly plastic surgery, that idea of the old plastic surgery, where it went wrong. And that's sort of separating the procedure as being what's most important, when in actuality it's really understanding this identity of the person. And that identity, their culture plays a strong role in it. Ancestry, it plays a large role in understanding those nuances of how you look and how you identify with yourself. So, a big component of the consultation in the initial stages is this dialogue, this back and forth that the patient and I sort of proceed together in understanding, like, who are you? What's your authentic idea of yourself? And then for us to embrace that together and say, is there a platform for us to tweak this? Is there a platform for us to enhance this in an appropriate way?
I'm intrigued here because it begs the question. If I come to you because I don't like my cultural identity, because there are certain, pronounced features that I have, and I want to escape those things, are you going to talk me out of it? What process are you going to take me through?
And we can go through examples in a certain sense. And the shock, I don't want to say the shocking thing, but the surprising thing is that almost never happens. I would say that the 99% of the patients that come to me embrace their culture. And it may be that they're self-selecting themselves to me because they know that I have a sensitivity for culture. So patients want to sort of have more of a celebration of who they are. Now, there are things that you can sort of refine and modify, but it's by no means are people looking to sort of conform to an aesthetic standard that is not theirs. Most of the times it's like, hey, first of all, doctors, I want you to understand who I am. And once we have that understanding, this is where I have a concern. This may be a little shifted. This may be a little too wide. There's a contour that I may want to enhance, So I think that it's a sign of the times.
So it's a myth then that people come because they don't like who they are. They're dissatisfied with themselves, greatly depressed about it, and they want to make this radical change.
I would say that's largely a myth. And I would also say that there is probably a selection bias in my patient population, but I would say that's largely a myth. And I think that for the most part, folks want to look like themselves, but a little bit better. And I think that when we look at our society, there is that push, that is out there. How can we be the best we can be?
But you're not confined to African Americans.
No.
I mean, you have Caucasian, you have Latino, Asian.
Right. Patients travel literally from throughout the world for, to seek out, some of the specialty techniques that we had. I was speaking to actually a Kenyan woman who's living in Norway the other day. So it's, I think that because the universe has gotten so small at the same time as it's big because of the internet and technology has allowed us to talk in so many different ways that folks are really seeking out these sort of niche types of expertise for whatever it is that they're looking for. And it just happens to be in that arena of the face, whether it's the nose, facial rejuvenation or hair restoration, we have a very, very, I think, innovative approach.
And you say technology because you've been featured on CNN, Good Morning, was it Good Morning America?
Actually, the early show.
Oh, the early show on Channel 2. And it's not surprising that a Kenyan would call you, reach out to you, and she's living in Norway. When we come back, I'd like to talk about the 3D imaging process. Because now with all this technology, it really helps a person see what they can become once these changes are made. Because I think before that, a person will have a procedure and then go back and have the same procedure again because they're dissatisfied.
Or have to take the surgeon's word for granted.
That's right. We'll be right back. Don't go away. Welcome back to our program, and thanks for staying with us as we talk about this cosmetic surgery thing with Dr. Monte Harris. 3D imaging, this is something new, and we're going to have some images up on the screen so people can see. Tell us about that.
I mean, this ability to see, has really revolutionized to a certain degree our approach to facial plastic surgery, and I think it's going to become a tool that becomes a part of the, the standard platform for how we engage in conversations with patients. And, we have technology now that allows me to, take a picture, with a quick click, and then it transfers that image into a software program which recreates a three-dimensional image of you. And we're able to sort of look at that image together, to understand the nuances of facial contour, to simulate surgery in my office. And what it does, and I think that what's most exciting to me is that it allows me to have really a different sort of relationship with my patients at the onset, and we can work together to sort of co-create, like I said, that vision of what do you consider to be your ideal beauty? You know, what's your authentic beauty now? How can we modify that? And it's literally, to a certain degree, sort of taking the mouse together and clicking, and we can move it this far and move it that far, and we can get a sense of like, is this the right change for you? Is this change go too far? Does this change or modify your impression of who you consider yourself to be? And there are nuances there that we haven't really been able to explore in the same manner as we can now with, you know, three-dimensional imaging. You know, when we look at movies like Avatar, you know, people want to be able to see. You know, they want to be able to have a sort of an authentic experience with what they're seeing. And we've truly never seen ourselves. We've only seen reflections, typically two-dimensional images, pictures, our face in the mirror. So 3D changes the game a bit in allowing us to see more of an authentic picture, and then to be able to modify that.
Is it surprising to your patients when they come in with one thing in mind, and then when you take them through the 3D process, they realize that, you know, that's not the best fit for them?
Right. And it is. It is surprising sometimes. You know, and actually seeing the image can be surprising. And I frequently now put a disclaimer like, hey, this is going to be a little shocking. You know, you haven't seen yourself look like this before. So, you know, I had a young woman that came to me just last week for rhinoplasty. And it's interesting that through the conversation, you know, I felt that, you know, this probably isn't the best thing for you. You know, when we look at this idea of creating an aesthetic platform that celebrates your authentic beauty, there may be some other things that we can do, or some other conversations that we can have.
Are there times when they insist, this is what I want, because in their mind, because, you know, a person could look in the mirror and see something totally different than the reality that you and I may see with them, you know.
But, you know, that's a part of the dialogue, because in those situations, it's never going to be a win-win. It's never going to be successful, because if they have a truly unrealistic sort of feeling of who they are, or unrealistic view of some particular portion of their face, and then I change that or I modify it, it ends up being sort of a scenario that we're not going to win. So, you know, I'm looking for ultimately for the patient or the client to be extremely happy, and I want to be happy. You know, so we go into that sort of dynamic together.
How close to that final decided on image is the actual result?
You know, and that's a part of experience, you know, coming to play. And that's experience as a surgeon, to really get a sense of that realm of change that we can pretty be reproducible. You know, and, you know, there's always variability with healing and swelling. But to a large degree, over time, you start to get a comfort level of saying that, you know, I can probably get it in this range. And then it's a dialogue, you know, with the patient to say that, here, this is what we're working at together. You know, so you know, I think one of the challenges is that sometimes surgeons not understanding cultural nuances, thickness of skin, or what looks good on a particular facial structure, we get, you know, sort of thrown off a bit. So, you know, having a good sense of what's consistent in my hands, having a good sense of what would look good on a particular type of face, and then having the patient and I sort of co-create that vision together, you know, we get it right most of the time.
Well, I mean, just talking to you, I can sense the comfort with which you have the person come to, you know, just with your approach. We've got to go to a final break. We'll be right back. Stay tuned. Now, we talked a little bit about the 3D imaging, and we've got some photos of that out there. What is your most popular operation?
You know, I would say there are probably three things that folks come to see me for. There is rhinoplasty, or nasal contouring, nasal reshaping. Folks come for minimally invasive sort of facial rejuvenation, you know, we're sort of throwing out that plastic surgery term, you know, and that is things that don't require a big incision, that can restore a youthful appearance. And that may be injections of Botox or fillers, or actually using your own fat. So that's a big thing that I do.
Really? That's
actually,
interesting.
yeah, it's called facial fat transfer. Where we can do microliposuction and then use that fat to sort of restore youthful contours of the face. And 3D is very big for helping me map out that plan.
Right, right.
And then hair restoration, and then comprehensive hair restoration. A lot of times the hair industry has been so male-dominated, you know, with there being a platform for thinning and balding in men. But with women, you know, there's really no leeway socially to have thinning or balding hair. So we have a very unique and comprehensive approach to restoring healthy hair, both for men and women, but really with a particular focus on women and hair loss, and women of different cultures with hair loss.
Now, women, as far as I understand, tend to dominate, you know, cosmetic surgery, but there are a lot of men who are now getting procedures.
Right, because it's okay.
Our culture has changed.
Our culture has changed, you know, so, you know, and the funny thing, I think the thing that gets men is the fact that, you know, and a lot of times they're brought in by their significant others or their wives, so, but, you know, there's a comfortable atmosphere, you know, particularly in my office, that men say, hey, Dr. Harris, I had a, you know, a little feeling about this mole, or, you know, can you do something about, you know, this little spot here, but this smaller
and they're
things,
comfortable getting involved. It's not just a women's thing. We can put aside that macho thing.
Right.
Dr. Harris, it's been great. Thank you so much for coming on the program.
It's been a pleasure.
And congratulations on the success of your practice. And thank you for joining our program today. And remember, for more information, please log on to arb.tv. Until next time, may God richly bless you and keep you safe.